Welcome to Podwave Plus.
Hmm.
You know, the material you sent for this deep dive is really fascinating.
Yeah.
We've got like this global report on air pollution,
Right.
and then this really detailed look at the impact
Hmm.
in India and Pakistan
Yeah.
on people's health.
Absolutely. Big topic.
And it seems like you're really trying to understand how the air we breathe connects to, well, just how healthy we are overall. So our goal today is to break down these sources, pull out those key points.
Right.
And there are some really, really shocking facts in here,
For sure.
like truly surprising stuff.
Yeah.
We'll look at the global situation
Okay.
and then really zero in on India and Pakistan.
Right.
We'll talk about mental health, especially for kids, because that's something people don't always think about with air pollution.
No, they don't.
And then, of course, the physical health effects
Yeah.
for everyone, but especially those little ones.
The little guys. Yeah.
The babies, the infants,
Right.
and even how long people might live.
Oh, wow.
It's heavy stuff.
Yeah.
And we'll get into what's causing this pollution.
Okay.
And what can be done. What can we do about it?
Good.
So let's start with the big picture.
Okay.
This global overview.
Global view.
And one number really jumps out
Okay.
from this WHO report.
Right.
In 2019, 99%.
Ooh.
99% of the world's population
Really?
was living in places where air quality didn't meet the WHO guidelines.
Gosh, that is almost everyone.
Almost everyone on the planet
Wow.
breathing unhealthy air. That's not just a few problem spots, right?
Yeah.
It's like the whole planet.
It's like a planetary problem.
Yeah. It makes you wonder about clean air as a basic human right.
Absolutely. Yeah.
I mean, if everyone is breathing bad air,
You have to think about that. Yeah.
and then if you look at the bigger picture of global health, this report said
Okay.
that outdoor and indoor air pollution together
Right.
are linked to 6.7 million premature deaths
Every year.
every single year.
That's massive.
It's a huge number.
Yeah.
And even if we just focus on ambient air pollution, the outdoor stuff, in 2019,
Yeah.
that was still 4.2 million premature deaths
Just from the outdoor.
worldwide.
Wow.
So a lot of what you sent focuses on India and Pakistan.
Right.
And that number, that 4.2 million, it's important to remember
Yeah.
as we talk about those specific regions.
Okay. Yeah.
But what's even more, concerning about that 4.2 million
Yeah.
is where those deaths are happening.
Oh, I see.
89% of them
Wow.
are in low and middle income countries. The report highlights this huge global inequality.
Oh, yeah.
Like Southeast Asia,
Right.
Western Pacific,
Yeah.
they're hit the hardest. It's not just an environmental issue, right?
Yeah.
This is about fairness,
Absolutely.
about social justice.
It really is.
The people with the least resources are suffering the most.
Mm.
So these deaths,
Yeah.
they're mostly from heart and lung problems and cancer.
Okay.
It's all because of these tiny particles we breathe in.
The fine particulate matter.
Yes,
Right.
much smaller than a grain of sand.
Tiny.
They get deep into our lungs,
Mhm.
even into our blood.
Wow.
The biggest culprit is heart disease and stroke, 68%,
Okay.
then lung diseases
Right.
like COPD,
Yeah.
and acute lower respiratory infections.
Mm.
Those are both at 14%,
Okay.
and then 4%
Yeah.
is lung cancer.
It's really affecting our vital organs.
It is.
Yeah.
And that's the biology of it, right?
Yeah.
These tiny particles,
Mm.
they cause inflammation
Yeah.
and damage over time.
To our cardiovascular system, respiratory system.
Exactly.
Mm.
So now let's talk about India and Pakistan,
Okay. Yes.
because the reports you sent really focus on that region,
Yeah.
and it's a serious issue there.
Yeah. For sure.
It's a major public health crisis affecting people who are already really vulnerable.
Right.
So what are the main sources of pollution there?
Well, there are a few key things.
Yeah.
Industrial emissions are a big one.
Okay.
So our vehicle exhaust, construction,
Right.
and then you've got agricultural practices, like especially the burning of crop stubble,
Well, yeah.
which can actually contribute up to 60% of air pollution.
60%
60%.
at
Yep.
certain times of the year.
Exactly.
And that's when you get those
horrible smog events.
smog events.
Yeah.
That's scary stuff.
Yeah, it is.
And the numbers are just heartbreaking. 1.7 million premature deaths.
Wow.
In India alone.
Okay.
in 2019 just from air pollution.
That's a lot of people.
It's devastating.
Yeah.
And it's even worse in the cities,
Oh, yeah.
urban areas,
Mm-hmm.
cities like Delhi.
Oh.
The pollution there
Yeah.
can be up to 50 times higher.
50 times.
50 times
That's not even.
than the WHO limits.
It's a whole other.
It's not just a little bit higher.
No.
That's a massive amount of toxic air.
Yeah. And people are breathing that every day.
Constantly.
Yeah, it's worrying.
And it's not just the sources of pollution themselves, right?
Yeah, I don't think so.
The location of these cities
Mm.
makes a difference too.
Right.
The report talks about geographic factors,
Yeah.
like around Lahore
Mm.
and Delhi.
Mm-hmm.
The way the land is shaped can actually trap smog.
Oh, really?
Yeah.
How does that work?
Especially in winter,
Right.
when you have those thermal inversions,
Yeah.
where
Right.
warm air traps cooler air below it
Mm.
and the pollution can't escape.
So it's like a lid.
Exactly.
Oh, I see.
And that leads to really prolonged periods
Oh, wow.
of terrible air quality.
Mm.
So this is all really bad for adults,
Yeah.
but the impact on children,
Mm.
it's particularly scary.
Oh, yeah.
Air pollution is a major risk to kids' health
Globally, yeah.
globally.
Mm.
And kids are more vulnerable
Yeah. I mean,
for a lot of reasons.
okay.
They breathe more air
Mm-hmm.
relative to their body size.
Oh, yeah.
Their lungs are still developing.
Right.
Their immune systems are weaker.
Mm.
And it's just heartbreaking.
Yeah.
Air pollution
Mm.
is one of the leading causes of death in children
Children under 5?
under 5 years old.
Wow.
It accounts for 1 in 10 deaths
1 in 10 globally.
That's just
It's
shocking.
a shocking statistic.
Yeah.
And in India specifically,
Okay.
the report says
Mhm.
that in 2017,
Right.
8.8% of deaths
Okay.
in kids under 5. Yeah.
Were because of air pollution.
Mm.
These are little lives
It's not just numbers.
cut short.
No, no.
And the physical health problems are just so many.
Mm.
Air pollution is linked to
Mm-hmm.
asthma,
Right.
pneumonia,
Mm.
bronchitis,
Those are all serious.
and those can lead to chronic problems
Mm.
that affect them their whole lives.
Yeah, for sure.
And it's not just those respiratory illnesses.
No.
It can affect their lungs,
Okay.
impair their lung function.
Mm.
It can even affect their development,
Oh, wow.
cognitive development,
Hmm.
physical development,
Yeah.
with long-term consequences.
It's really far-reaching.
It is.
Yeah.
And it's not just their lungs, right?
No.
You mentioned hearts and brains.
Right.
It affects those too.
Mm.
Air pollution is also linked to
Uh-huh.
cardiovascular problems,
Mm.
neurological problems
Right.
in children. And those can become chronic conditions
Oh, wow.
in adulthood,
Hmm.
which then puts a strain on healthcare systems,
Right.
affects their quality of life,
Yeah.
maybe even shortens their lifespan.
Right.
It's a huge problem.
It's a cascading effect.
Yeah.
Mm-hmm.
Now, one thing that I think is really important
Yeah.
and often overlooked
Mm.
is the impact on mental health.
Oh, yeah.
And these reports you sent really highlight that.
Mm.
There's a growing awareness that air pollution
Okay.
can affect our mental health
Right.
in significant ways.
Mm.
And it's not just physical health.
Right.
It's our minds too.
Yeah.
So people are starting to recognize this.
Mm-hmm.
The reports talk about
Right.
links to anxiety,
Right.
depression,
Mm.
even psychosis.
Oh, wow.
These pollutants,
Mm.
they don't just affect our bodies.
No.
They actually affect our brains.
Mm.
And that can cause real psychological distress.
Mm. Yeah.
And this is even worse
Mm.
in communities that are already facing a lot of challenges.
Right.
So, it's like a double whammy.
Mm-hmm.
And again,
Yeah.
it's those tiny particles,
The PM 2.5.
PM 2.5.
Mm.
That seemed to be the biggest problem,
Right. Right.
the
right.
research says.
Okay.
That they can cause inflammation
Mm.
and oxidative stress
Yeah.
in the brain.
Right.
So that biological response
Okay.
can lead to
Uh-uh.
depression,
Right.
anxiety.
Mm-hmm.
So it's like a direct link
Yeah.
between physical pollution
Right.
and mental health.
Mm.
And this is especially worrying for children.
Yeah, because their brains are still developing.
Exactly. Their brains are still developing.
Mm-hmm.
So exposure to PM 2.5
Mm-hmm.
can have a negative impact on
Yeah.
cognitive development.
Right.
And that can lead to
Mm.
behavioral problems,
Okay.
mental health issues
Right.
as they get older. And it's even worse
Yeah.
for kids in really stressful environments,
Mm.
like urban slums,
Okay.
where they're already facing so many challenges.
Right.
So the air pollution is just another stressor on top of everything else.
Right. Yeah.
And it's not just about location, right?
Yeah.
Socioeconomic factors play a role too.
Yeah.
The reports say
Okay.
that in countries like India and Pakistan,
Right.
where pollution is generally higher,
Mm.
people are more likely to have mental health problems
Oh, I see.
because of the air pollution
Right.
compared to countries with cleaner air.
Mm.
So again, it's about environmental justice.
Absolutely.
It's just not fair
Mm.
that people,
Yeah.
poorer countries,
Right.
have to deal with this on
Mm.
top of everything else.
Yeah.
So living in a polluted area can directly affect
Right.
your mental well-being.
Mm.
It can make you feel more stressed,
Okay.
anxious, make it harder to think clearly.
Right.
And there's a study that was done in Lahore and Islamabad
Okay.
that looked at this
Right.
in school children.
Oh, wow.
And they found a link between
Yeah.
smog
Okay.
and cognitive problems.
Hmm.
So poor air quality
Yeah.
isn't just hurting their physical health.
Right.
It's affecting their brains,
Mm.
their ability to learn,
Right.
their future.
Mm.
It's really worrying.
It is, yeah.
And then there's the economic costs.
Right.
The report talks about that a bit.
Okay.
It's pretty clear that if a whole population is dealing with these health problems,
Mm.
that's going to affect the economy
Yeah.
because of healthcare costs
Right.
and people not being able to work,
Lost productivity.
lost productivity.
Yeah.
So, mental health problems alone
Right.
can be really expensive
Mm.
for healthcare.
Okay.
Lost work,
Mm.
social welfare programs. And then you add on the physical health problems
Yeah.
from air pollution.
Mm.
And it's a huge strain
Yeah.
on the economy.
Right.
If people are sick,
Mm.
if they're struggling mentally,
Yeah.
they can't work.
Right.
They can't contribute.
Mm.
And the report didn't really talk about tourism,
Mm.
but,
Yeah.
you got to think
Okay.
that these terrible smog events
Mm.
in South Asia,
Right.
they probably affect tourism.
Yeah. You would think.
I mean, who wants to go on vacation
Right.
to a place where the air is dangerous to breathe?
Oh.
Those pictures of thick smog,
Mm.
they're not exactly inviting.
No, not really.
So if a country relies on tourism,
Hmm.
air pollution could really hurt them.
Yeah, you're right.
Less visitors,
Mm.
local businesses suffer.
Okay.
People lose their livelihoods.
Mm.
It's a ripple effect.
Yes, yeah.
So the problem is huge.
Yeah.
It has all these consequences.
Mhm.
The big question is, what can we do about it?
Right.
And the WHO report,
Mm.
it does offer some solutions.
Oh, good.
It says that a lot of this outdoor air pollution,
Mm.
it's not something individuals can control.
Right.
We need big changes
Okay.
at the policy level
Mm-hmm.
in things like energy,
Right.
transportation,
Mm-hmm.
waste management,
Okay.
urban planning,
Mm-hmm.
agriculture.
Yeah.
And it gives some specific examples
Mm.
of successful policies.
Oh, good.
So for industry,
Okay.
things like cleaner technologies
Mm-hmm.
to reduce emissions,
Right.
better waste management,
Mm.
including capturing methane
Okay.
for energy,
Mm.
making sure people have access
Yeah.
to clean household energy.
Right.
Transportation.
Mm.
We need better public transport,
Okay.
cleaner vehicles
Mm.
in cities.
Yeah.
We need to improve energy efficiency
Mm.
in buildings
Mm-hmm.
and create more green spaces.
Mm-hmm.
And for power generation,
Yeah.
more renewable energy.
Right.
And then waste management.
Okay.
That needs to be better
Mm.
for both cities and agriculture.
Mm-hmm.
We need to reduce waste,
Yeah.
recycle more,
Mm-hmm.
and find alternatives to burning.
Okay.
It's a lot,
Yeah.
but it can be done.
Right.
And India has already started some initiatives.
Oh, yeah.
Commission of Air Quality Management
Okay.
and the National Clean Air Program.
Mm.
These are national efforts
Right.
to improve air quality.
Mm.
But it's not just up to governments.
Yeah. No.
What can individuals do
Yeah.
to protect themselves
Mm.
and contribute to solutions?
Okay.
So the big changes need to happen at the policy level,
Right.
but we can still do things
Mm-hmm.
like using air purifiers at home,
Okay.
wearing masks
Mm.
when the air is really bad,
Right.
being careful about when we exercise outdoors, avoiding those peak pollution times.
Yep.
We can support local initiatives
Right.
working on clean air.
Yeah.
And we can talk to our elected officials
Mm-hmm.
Tell them we want cleaner air policies.
Yeah,
So we've covered a lot of ground today.
we have.
And the information you sent,
Mm-hmm.
it really paints a clear picture.
Mm.
Air pollution is a huge problem
Right.
with consequences
Yeah.
that go way beyond our lungs.
Mm.
It affects our hearts,
Right.
our minds, our children's health and well-being.
Absolutely.
The number of people dying prematurely
Mm-hmm.
and the link between air quality and mental health,
Right.
especially for vulnerable populations,
Yeah.
it's honestly shocking.
Yeah, it is.
It's really shocking.
Mm.
And what I find really interesting
Yeah.
is how this connects
Mm.
our individual health
Okay.
to these bigger issues,
Mhm.
like the environment
Right.
and society as a whole.
Mm.
It shows that our well-being is really tied to the air we breathe.
Absolutely.
So I know it can feel overwhelming.
Yeah.
It's a big problem.
Hmm.
But,
Yeah.
these reports also give us some hope
Oh, good.
because they outline solutions and they show that we can make a difference
Right.
by supporting policies
Hmm.
that promote cleaner energy,
Okay.
cleaner transportation,
Hmm.
better waste management. And even at the individual level,
Right.
we can be more mindful consumers,
Mm.
support local initiatives,
Okay.
and together
Yeah.
raise awareness,
Right.
demand healthier environments.
Mm.
It's really about,
Yeah.
what kind of future do we want
Mm.
for ourselves,
Right.
for our children.
Mm.
So I guess my question for you, the listener, is
Mhm.
what stood out to you the most
Okay.
from this information?
Yeah.
What questions do you have
Mm.
about your own environment and your own health?
Mm.
I really encourage you to check out the resources
Mm.
mentioned in the WHO report
Right.
and think about
Mm.
how you can support cleaner air efforts
Yeah.
in your own community.
Mm.
What role can we each play,
Yeah.
both individually
Mm-hmm.
and together,
Right.
to solve this global health crisis?
Oh, that's the question.
It's a big one.
It is.
So if you found this conversation insightful,
Mm.
please consider subscribing to our channel
Okay.
and sharing it with others.
Right.
Let's raise awareness
Mm.
because understanding the problem is the first step to finding solutions.
Absolutely.
Thanks for joining us on Podwave Plus.